is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Thalahungva. Today marks the 96th anniversary of the Indian Citizenship Act, which finally granted U.S. citizenship to all Native Americans. On June 2nd, 1924, President Calvin Coolidge signed the act into law, which impacted an estimated 300,000 American Indians. Before that, there was a long debate at both the state and federal level over the full birthright citizenship status for American Indians. Yet, just because American Indians were granted citizenship, their right to vote was still not guaranteed. In 1948, two states still prohibited tribes from voting. They were Arizona and New Mexico. And speaking of voting, voters in 9 states and Washington, D.C. are casting their ballots in primary elections today. And there are a record number of Native candidates on the ballots across the nation. All candidates face an uphill battle this year, campaigning in the era of COVID-19. Candidates are not knocking on doors, shaking hands, and kissing babies. Many are using Facebook Live to host virtual town halls to interact with constituents because they can't meet in person or in large groups. Notable elections today include New Mexico and Montana. 2 Native Republicans are running for a Senate seat in New Mexico, Elisa Martinez from the Navajo Nation and Gavin Clarkson from the Choctaw Nation. Montana has the largest number of Native candidates, with 25 running for office. A new CEO will take over the Gallup Indian Medical Center in New Mexico. Mark Alford, the Choctaw, he brings 20 years of healthcare leadership to the center, according to the Indian Health Service. No word on his actual start date. And now for the latest numbers of COVID-19 cases in Indian Country, let's go to Jordan Bennett-Begay, our Washington editor. Jordan?
Yat Patty, Yat Shikisto Shidine. 5 tribes reported more COVID-19 cases and deaths in the past 24 hours. And here are the latest numbers from our database. There are 7,855 positive confirmed cases and 311 deaths in the Indian health system. Again, that is a total of 7,855 positive confirmed cases and 311 deaths as of this morning. The White Mountain Apache tribe in Arizona reported 20 more cases and 1 additional death. This gives the tribe a total of 769 cases and 8 deaths. Also in Arizona, the Salt River Pima Maricopa Indian community reported 1 more case. The tribe has a total of 47 cases now. And the Mississippi Band of Choctaw Indians in Mississippi saw a rise in 53 cases. This brings the total to 654 cases for the tribe. And in New Mexico, the Mescalero Apache tribe announced 3 new cases, which is a total of 10 cases for the tribe. 9 of the cases are residents who live on the Mescalero Apache reservation, and 1 is a tribal member who lives off the reservation. For the Navajo Nation, which stands across Arizona and parts of New Mexico and Utah, they reported 131 new cases and 2 additional deaths. Over the weekend, the tribe also announced that there are 61 additional deaths. Tribal officials said that these deaths had to be verified by local and state partners, which took some time for them to verify, of course. And Indian Country Today doesn't know if these deaths are individuals who lived on or off the Navajo reservation, but we're working on to confirm that, Patty.
All right, so we have a number of tribes that are reporting new cases. And to give us an idea on the impact, some of these tribes are fairly small, with maybe less than 5,000 tribal members.
Yes, no, they are. Like a lot of the pueblos also have very small, which could affect the infection rate and the spread of it. But it's really interesting. The Mandan, Hidatsa, and Arikara Nation up in North Dakota, their residents have all recovered from the virus. So we're working to see what they did that worked to stop the spread of it. That's the latest we know right now. And I think what people need to know that this data collection is difficult to, a lot of tribes report their data differently, and also Native people live everywhere in the country. They don't just live on the reservation. All of them live away from their tribal homelands too.
And so many of them could be being tested in city hospitals or and not on reservation lands. All right. Well, Jordan Bennett-Begay, thank you so much.
Yeah, Patty.
And we'll be right back.
This is Indian Country Today.
Welcome back. The Gila River Indian community in Arizona is one of 3 tribes close to the Phoenix metropolitan area. Early on, they started aggressive testing for COVID-19 and getting the word out to their tribal members to stay home. They also closed their casinos, but have since reopened with some changes. Joining us today is Stephen Lewis. He is the governor of the Gila River Indian community. Thank you, Governor, for joining us today.
Thank you, Patty. It's a real honor to be able to come on your show and to tell the story of the Gila River Indian community.
Well, let's talk about the aggressive testing, because right away you put into place policies that would allow your tribal people to start getting tested for COVID-19.
That's right. I created a COVID-19 task force in response to this pandemic early in late January. And the goal of it, Patty, was to test, trace, and treat and contain the goals of incidents of and the spread of COVID-19 in our community, Patty. So, we felt really the need to get this communication out to the community as soon as possible, to start to educate our community members as well in this public health pandemic. And, I think we all know now, and looking back at the beginning, that this is an unprecedented healthcare crisis emergency. And so the absence of that information, especially among Indian country, created a lot of fear among our community members. So it was important, and also too, what we're seeing and what we're learning, that the COVID-19 virus is so easily transmitted. It truly is, Patty, a silent enemy. So early on that we focused on putting all of our resources also in getting as much information and public health education out there to the community. So I also utilize my executive orders under our Constitution as governor to prevent travel early on, shelter in place, and to limit gatherings. As we know that the CDC early on was no more than 10. And so I incorporated that into my executive orders, and to make sure that community asymptomatic members of the community didn't unintentionally spread that disease. That was all part of the goals at the beginning that the community instituted, and that I ordered all of our departments and our Gila River Healthcare to work in coordination with, Patty.
And what is your tribal population on the reservation, on the community?
Right. We have probably just over 13 to 14,000 that live on the reservation. Our total enrollment is just over 23,000.
And so out of the 13,000 plus living in the community, what are your COVID-19 positive cases? What are those test numbers?
Right. As of currently, we have 30 members who are residing in our community that have tested positive. And we have Gila River Healthcare, which is our healthcare system that we run independent of the Indian Health Service. And also, so this serves our community, but it serves our, the area that it also serves over 100,000 potentially Native Americans as well. So we've also tested Native Americans from other tribes. And our recent numbers are that we've tested those enrolled members of federally recognized tribes who have presented themselves to be tested at Gila River Healthcare. We have 100 documented cases of positive COVID-19 from other federally recognized tribes that have tested at Gila River Healthcare as well, Patty.
And we'll get more into that in a minute here, but I'm asking about your population because it really shows that a population of 13,000 plus people who live in the community. Out of that, you have the 30 cases of positive COVID-19 tests. And I understand you've had 2 deaths in your community.
Sadly, we've had two deaths, elders from our community, and and that's too many.
Sure, but again, I think that it shows that proactive, aggressive testing and awareness campaign seems to have helped with your community there, without this virus spreading so rapidly that we're seeing in other with other tribes.
Patty, it has. We've seen testing, barring a vaccine, testing is the most critical tool that we have to flatten the curve, to get ahead of this, to protect our community and our employees as well. What we're doing right now, and you talked about that earlier, our tribal gaming facilities that have come online, I think for the past 2 weeks now, we instituted measures to have mandatory testing of all of those employees before they returned, as part of our reopening plan, as well as other social distancing measures as well. But testing was a critical part of that as well, especially as we start to look at reopening our tribal government, our departments. We are doing testing as well, mandatory testing of all of our tribal employees, both community members and non-community members. And we're doing this not just a one-off, but we're doing this every 2 weeks. And we've partnered with Steward Healthcare Systems based in Phoenix as well. And on top of this, our Gila River Healthcare is doing wide area surveillance testing as well. So of course, our community is divided into 7 districts. And right now, this is beginning in its 2nd week, we are doing testing at each district for all community members. Those that live on the reservation, as well as those community members who live off, can come and they can get tested as well. So we can start to create a baseline of information in regards to COVID-19 testing and treating, and those that are asymptomatic as well. Looking at also making sure that once those cases are identified, that we can start to quarantine those households for the safety of everyone within our community, Patty.
Well, I know that you also received the Abbott lab that would then process the tests. And in addition to that, the state of Arizona sent 5 ventilators to the Gila River. Have you used those ventilators?
So Patty, we were one of the first tribes to get the Abbott analyzer, and so that has a rapid results COVID-19 test, but it has limitations as well. We can run and do a COVID-19 test and get the results back within 15 minutes. So of course that would be limited to doing 4 tests an hour, and there are limited supplies as well. And I know early on there were some concerns about the testing procedures as well, and so we've been working with the provider to make sure that we're using the correct testing materials to make sure that the efficacy of those testing results are proven and are as as correct and accurate as possible. And we've actually used those in potential COVID-19 positive cases within our community and our tribal government. We used the Abbott 4 times in 4 separate instances where we found positive cases, and that we could rapidly test and identify those potential hotspots. And also, in regards to the ventilators, those are actually put to use right now within Gila River Healthcare. We have one of our new ambulatory facilities, the Red Tail Hawk facility, off of Old Price Road in Queen Creek, that also serves a lot of urban Native Americans as well as our community members. We've turned that into a field hospital as well. So potentially, if there is a time where hospitals there are no beds available, we have beds available within our Gila River Healthcare as well. In fact, we have at this time we have 75 beds available in the event that there are no beds available because of the COVID-19 pandemic, and beds are full. So those ventilators are actually being used within our facilities as well for that type of scenario, Patty.
It's been a crazy situation, you know, since March when it really hit here. And recognizing that so many of our Native people live in urban areas and can utilize healthcare such as, you know, the ones that you provide within your community. How are you reporting these cases, positive cases, back to that person's specific tribe? So if you're Hopi and you go there to get tested and you're tested positive, are you letting the Hopi tribe know? Or if you're from Lame Deer, Montana, and you live in Phoenix and go to your facility to get tested, how are you handling that information?
Right, Patty. Early on, you know, this is, you know, really, you know, Patty, and truly, I would say, healthcare professionals, tribal leaders, you know, there was no roadmap as to how we were dealing with this pandemic. And early on, and I still get a little, uh, you know, some emotion. I would have to reach out to call my fellow tribal leaders personally on the phone and let them know that one of their tribal members had presented themselves and tested positive within our healthcare facility. That was early on, and I would do that, uh, you know, just at the beginning. You know, you know, there were times, maybe even a couple times a week, that I would have to get on the phone and talk to my fellow tribal leadership. Now, our public health and our Gila River healthcare systems, we have a protocol now as well where they follow up um, with these cases as well. A lot of it has to do with, of course, where they reside as well, because of the of contact tracing that has to occur to follow up, you know, with these individuals as well. So if they live in Maricopa County, if they're or reside as an urban Native American, we have to also contact the county they live in as well. So we've really built a sophisticated system, and I know other tribes have done so too, in regards to contact tracing, in regards to coordinating with other tribal public health facilities, as well as the surrounding cities and municipalities too.
Is it kind of like trying to build a boat in the middle of a lake?
You know, I think as tribes, I think that would, as Native Americans, I think that would be more easily identifiable. My Office of Emergency Management would say building an airplane while we're flying. That was early on, because we, as other tribal nations go, we've also instituted an incident command structure as well. I know most tribes in Arizona have done that as well. And they have very robust information systems that they try to communicate out to their community members as well. And I want to say too, you know, just having to have both either Arizona tribal leaders calls, national calls, or just talking to tribal leaders, picking up the phone and talking to them. You know, that I'm so proud of our tribal leadership that have stepped up and that have just really have risen to the occasion to lead in this climate of a global pandemic that is hitting Indian country hard, especially here in Arizona. And I think that's one of my really just a great comforts at times to you know, to get the support and to provide support to other tribal leaders as well, both here in Arizona as well as across Indian country, Patty.
All right. Well, let's talk about the casino closures, because you know that's a huge part of the revenue for Gila River, and it was closed for a couple of months. They're now reopened. So, what is that? How is that working out? Because there's you know different a change that you're going to see when you walk into your casino.
Right, and you know, that decision wasn't easily made, Patty. You know, by our tribal leadership, we had to make sure that we had a reopening plan that was safe, both for our employees as well as for our patrons as well. And again, going back to testing was an important part of that, a critical part of that, testing all employees and continual testing as well. Having PPE both for employees, but also for our customers, our patrons that come in as well. We've, you know, I'm so proud of our tribal gaming Gila River Gaming Enterprises, their leadership that provided social distancing, and that's so hard within a casino gaming environment. They reconfigured the floor to spread the slot machines and tables as well to make sure that there was adequate social distancing. We have non-smoking areas as well, and both the restaurants and the hotels are closed temporarily as we
All right.
do a phased reopening, Patty,
Yeah.
as a part of our safety features.
Okay. And so the other thing that's happened, of course, are the protests that are taking place across the country with the death of George Floyd, and the Arizona governor has imposed this curfew of 8 p.m. Has that impacted? It's only been a few nights, but are you seeing an impact in people coming into the casino now?
Well, I know that the rest of the casinos in Arizona, the travel casinos, are opening up, beginning to open up this week as we move forward. And of course, an executive or a governor's order from a state order does not have effect on the community as a sovereign nation
Right,
as
but
well.
people coming from Phoenix into the casino, are you seeing a drop in people coming in?
Right. At this point, we don't see a drop so far. Of course, we're very concerned about the safety of our employees and our patrons as well. We have extra security and law enforcement. We have three casino sites: Lone Butte, Wequiva, and Wild Horse Pass, and so we're taking safety into into highest regard as well. We've actually reached out to the governor's office as well, and got some guidance. And I think there from what I've been reading as well in the news, there's a lot of confusion as to exactly how the governor's curfew would be implemented, and actually who and what activity is this targeting as well. For us, we were told that our patrons and our employees that go to work, that come to our casinos, are not targeted by this curfew as well. So that's why I think that was what, and of course in other tribal casinos and alike as well. And so I think that was what gave the go ahead, or at least to allow our tribal leadership as well as our gaming enterprises to keep our casinos open. And I believe the other tribes that have their casinos open as well.
They're coming back online. So,
Yes.
Governor, on May 5th, you met with the president, and here in Phoenix when he came to tour a plant, and then after that, it came out that several people at the White House had tested positive for COVID-19. After that meeting with the president, did you also get tested to make sure, because you were in close proximity? Did you actually shake his hand?
I did not shake his hand. There was social distancing. And I did take a COVID-19 test the day before. Everyone who was in that what was labeled a tribal roundtable did take a COVID test. I was negative, of course, and I think and everyone else was negative to be allowed to be in that meeting with the president. And I've since taken 2 other tests as well, and both come back negative. Yes, and
You just can't ever be too careful, right? So before
no, you
we go,
can't.
very quickly, the $8 million in the CARES Act fund, are you satisfied now with the distribution, and are you looking forward to the next round of funding?
We're looking forward to the next round of funding. I know we have a limited amount of time here, but I think for the Gila River community, we're just wanting to make sure that the process was fair and equitable, and not to have some tribes get too much money and other tribes not get enough. This goes back to the Treasury as well, not really dictating to tribes as to how they should get the money, rather than listening to tribal leaders and to tribes saying, this is what we need the money for. These are our needs. And so I think we really need, as Indian country, we need to hold the federal government to that trust responsibility as well. And
Okay.
so these Yeah, and moving forward, we have to maintain that trust responsibility. We have to maintain, and that's why I told President Trump is that we need a fair and equitable distribution of these critical COVID-19 funds resources moving forward for all tribes.
Governor Stephen Rowe Lewis from Gila River Indian Community, thank you so much for joining us.
Thank you so much. And what I always tell my tribal members is to stay Gila River strong. And I want to tell all of my brothers and sisters out there, I know there's a lot going out, both in Indian country and in our nation. Please,
Thank you.
Stay strong out there.
All right. Uma umukatsi ukalyani. Take care of yourselves. Your life is precious. I'm Patty Tolahungva. Join us again tomorrow.
This is Indian Country Today.